Hello, everyone. Well, we are going to be talking about lower back pain. Lower back pain is the single leading cause of disability worldwide that costs almost $50 billion each year, believe it or not. So we want to bring a chiropractor, and we have Dr. Khoo with us. She is educated in Australia, and she's a chiropractor in Malaysia. So welcome, Dr. Khoo.
Hi, Anita. Nice to meet you.
Great. So the
Yeah.
topic today is lower back pain and correlation with the pelvic. So let's just understand, first of all, what causes lower back pain, and then we will move into the correlation of pelvic and lower back pain.
Yeah, sure. Maybe I'll start with explaining what is the pelvic and what is lower back pain.
Mhm.
I will show you a photo through this share screen. Okay. Let's see the okay, can you see it?
It's coming up. It's coming up. So, okay, I'm adding it to the stream. Yes,
Yeah.
we can see it.
Okay, so you can see my mouse hovering over as well, right? Okay,
Mhm.
so what is the pelvic? So this is what we're looking at. This is the pelvic girdle. It is consists of mainly the two innominants here. Well, in layman terms, we call it the hip bones, okay? And then we have the sacrum and the coccyx, the tailbone over here. So this innominant over here, it consists of three regions, which is the ilium, the ischium, and the pubic symphysis, okay?
Okay.
Okay, so what is lower back pain then? Lower back pain can be, involving the muscles pain, the nerve pain, or even the bone pain. So sometimes it varies person to person. Maybe the person would say, oh, I have really dull ache in my lower back, or even sharp pain. And some even it only happens yesterday, or it can happen in a very long period, say in a period of 6 weeks that comes and goes, and or they will have a chronic lower back pain where we call it about a 12 weeks period, kind of a lower back pain. So what is the contribution factor to that? So through my clinical experience, there are actually various causes to that. Number one, that is the most common one, is actually the weak muscles. Okay. Number two, the sudden onset one, it's actually, we call it a biomechanical joint dysfunction. Or in America, maybe they will call it the subluxation, but not the dislocation kind of thing. It's actually a misalignment. If we say in a more where the audience would understand easier, we call it the misalignment. Okay, so then the misalignment of L4 and L5 is very common, and as well as the sacrum area, which is this this bone over here that I'm showing.
Oh,
okay. Yeah. Yeah, and then the third one that I see most common is actually the besides the weak muscles, right? There are also muscles that are really tight that tense up, and actually you can't see it here, but there are nerves going through the muscular structure as well. So if your muscles are too tied up, tenses on the nerve, and our nerve have sensors, right? So that it gives you that sensation of pain or very tight pressure kind of feeling.
Okay. So what you're describing is, I just want to make sure. So obviously, the spinal cord is connected with the pelvic bones, so, that whole region. So is it because of the wrong posture that people, we have to maintain, like, so that we are in balance? Like, it looks like a beautiful, like a little butterfly, right? And then
Yes.
there's a thing that's, tree branch that's going in. I mean, that's from a layman's term. So the
Correct.
has to maintain. I mean, how does it work?
So okay. So maybe I'll show you. So this bone here looks very perfect. It's balanced. It's normal.
Yes.
So maybe I'll show you an X-ray where
The
that
things are
they
not balanced.
show the imbalances. Okay.
Okay.
So I think diagram really speaks a lot of things. Okay, let's see this one. Very obvious, right?
Oh, yes.
Yeah, come on. This one is like, you can see. So I usually, let's see the mouse over here. So I'll draw a line, I will draw a dot here, and also a dot over the pubic symphysis area. So that if you see, right, it doesn't intersect directly on the middle, correct? So meaning very obvious. Number one, it's already shifted. Well, if we don't even draw the lines, we can see it.
Yes, yes.
So then, and if your pelvic is already shifted, or we call it rotation as well, then can you see the structures above? How are they compensating?
Oh, wow.
So then, if we look from the side view, there are nerve exits as well. Then it will actually affect the size of the nerve exit. Yeah, and then so from X-ray you can't see the muscles, right? So then we can see a better view, which is here. You can see all these muscles over here. Yeah. So if imagine that X-ray over there on this person, and imagine the muscles are attached to the bone itself. So if they're misaligned, so can you imagine the muscles is like
kind of
following it? Correct. So then there's a series of like structures being affected. You can't just say that, oh, it's only the bone or it's just the nerve. You can't separate them.
Understand. So it's the whole thing together that will cause. So now I know there's a lot of research that talks about spinal manipulation. What chiropractors do is as effective as taking prescription drugs. So talk us about that and what happens. When a client walks in, what is the process?
So actually, why would they feel this pain? Actually, mainly is because the root cause. We all know that diagnosis is very important.
Yes.
So as a chiropractor, we obviously diagnose low back pain or any other back pain due to a mechanical problem. So if it's a mechanical in nature, I believe drugs is not the best only approach for it. I mean, it helps with the pain sometimes, right? But you still want to address why is this happening. So going back to the X-ray. So okay, of course the treatment will vary depending on the individual. So let's say this person is already well matured, but let's say if he is a teenager or maybe in the early 20s, maybe mid 20s, I would say this misalignment, right? We as a chiropractor, I'm quite confident to actually address that alignment issues. So we will identify the direction of, let's say, okay, let's look at the right side over here. If it's rotated, it kind of look like that now.
Yes.
So I have to find a way to make it come back. So my technique that I'm using, I have to figure out the direction of my adjustment for that bone, as well as visualizing the muscles that I'm supposed to address, which maybe the right muscles need a lot of muscle release. Then the left side needs some firing work, like maybe because when you have this kind of misalignment and the pain, it switches off the muscle activation. So if your muscles are sleeping, so they're not working, so you are supposed to wake them up and ask them, come on, you're supposed to work, and then you're supposed to bring this back to the straight line kind of thing.
Straight line, like
yes.
the little butterfly we saw in the beginning, right?
Yes, correct. We want like this one over here. But of course, based on my clinical experience, that I do encounter challenges to bring it back to this position. Is because number one is age. Number two is if you look at these structures over here, if these have there are spaces in between, okay, here, and this space as well, if they are already quite degenerated, so I don't promise my patient, I can help you realign back. Yeah, because there are already structural damage. So all I can do is I say I can help you minimize, but I cannot say that it won't, it will be, be gone forever kind of thing. But I can help to achieve like maybe 70%, 80%, yeah. Kind of pain-free.
Sure. So let's talk about is it bad posture that is the root cause of lower back pain? Because we are sitting now, right? Sitting is the new smoking. A lot of research talks about that. So what are the different reasons that people are now experiencing lower back pain? And by the way, if anyone has any question, I see someone would put a comment. You are welcome to ask questions.
Yeah. So actually, Right now, actually in Malaysia, we're actually having we call it the movement control order. So people are encouraged to stay at home,
Yes.
and even last year, everyone is encouraged to stay at home as well.
Mhm.
So you sit very long time, prolong, and then you like to cross your leg. Okay, maybe you cross your leg for a few seconds, it's fine. But if
Mhm.
you're crossing your leg for like 5 hours
Yeah.
in that kind of position, or maybe your laptop is not in the right eye level position, all that,
Mhm.
it then your spine will be like working,
Mhm.
even though you are sitting, and then
Mhm.
you're stressing your spine.
Mhm.
So then the misalignment then slowly follows. The duration of your sitting matters, and the way you're sitting it also matters. And of course, if you don't have a support on your back, you're
Mhm.
actually like pretty much during the 8 hours, you are using your muscles to hold yourself up.
Mhm.
Yeah. So you don't
Yeah.
have like enough rest. And then if you don't walk in between, or the lack of movement is
Mhm.
one of the big reason why
Mhm.
they're having the lower back pain as well. Because again, if you have a dysfunction, a misalignment, then you switch off the muscle that's
Mhm.
supposed to work. Yes. And of course, very actually quite common in Malaysia, unfortunately, obesity.
Mhm.
Yeah,
Obesity.
that could also contribute to the mechanical back pain, I would say.
I see. So there is
Mm.
a weight, obesity, overweight, and then the second thing is if you're not sitting properly, because we sit almost 8 hours because of the lockdown. And then, okay, so what is the right posture? Can you share with us how should we sit? Like erect, or what is the right?
Ah, okay. So right now I'm looking at my screen. So you're supposed to be like, say my laptop is right in front of me, right? Okay,
Yes.
right now. So this is my screen, my hand. All right. Okay, let's see. Ooh. Yeah, there you go.
Yeah.
Okay, that's my screen here. So you don't want it to be like too low. Wait,
Mm-hmm.
let me see here. Too low. You
Mm-hmm.
want to be like okay, this is just for camera purposes, so it's not supposed to be so close, all right?
Yeah.
I'm sure you need a distance between your screen, but gotta be eye level so that you're not straining your neck.
Mm-hmm.
And then if your screen is too far away, please bring your screen a bit
Mm.
uh closer to you, but not too close because of your eye, like for your
Yeah.
vision.
Yeah.
But if you're too far away, you'll be doing this.
Oh, so that also kind of goes like, yeah.
Yeah, you're gonna be like the turtleneck kind of thing.
Mm-hmm. Mm-hmm.
Yeah, straightening your neck. And of course, in terms of your sitting,
Mm-hmm.
like sitting position, you
Mm-hmm.
want to make sure your feet right now, okay,
Mm-hmm.
have a feel it's landed very comfortably on the ground.
Mm-hmm.
So if maybe tall person is not a issue, but if it's for short people,
Mm-hmm.
they might need some actually books or something to just make sure that the feet is landed comfortably on the floor. It's not like
Mm-hmm.
you're not like hanging in the middle of the air kind of thing.
Mm-hmm.
It's quite uncomfortable if you try. Okay, because you'll be using your glute muscles and lower back then let's say your chair, I have an ergonomic chair, so
Mm-hmm.
there is a lumbar support.
Mm-hmm.
So if let's say this is your back, your lower back, okay, let's see,
Yeah.
then you will have a support over here, like a maybe put a pillow.
Mm-hmm.
Yeah, and I think that's pretty much it.
Okay.
Mm.
So, all right. So let's talk about chiropractic care, right? So let's say
Yeah.
not as serious as the one you showed us earlier, which is degenerative, but simple adjustment. So what? How do you? I mean, I'm always fascinated with what chiropractors do. So,
Yeah.
like, how do you crack it like this? You know what I'm saying? Like, what the heck do you do that the bone is this, and then you kind of go crack it like that? I mean, explain us a little bit about the chiropractic care part.
Okay. Okay. So chiropractic is a very interesting profession.
Yeah.
So I'm pretty sure everyone is very curious. What do we learn in university and how it actually helps us to find the problem.
Mhm.
So first and foremost, what we learn I learned from based on like clinical experience as well. Okay. So we will palpate the bone.
Mhm.
Palpating means, for the audience, all right, means we will feel for the structure of the bone.
Okay, so you
From
by hand.
yes,
Okay.
yes, correct. Of course, now we have to wear gloves, obvious reasons.
Yeah.
So then we have to be very familiar from the first neck bone until the hip.
Mm-hmm.
Actually, all over everything. We get tested for all the bone structures. We have to be very familiar with where it is. Okay, so we know already. Then actually we take about 1 to 2 years just learning this skill, feeling of the bone and feeling the movement of the bone. So literally, let's say for myself, so this is just feeling, but feeling the movement, we call it the motion palpation, is where we will move the patient, and then my finger will be on the bony structure, just to feel whether if it's mobile, if it's within an acceptable range, or is it just like when I move, it just doesn't move at all under my fingertips. Literally, you'll feel it's a block end feeling, a really stuck feeling. Then you will know, okay, I think this is one of the reasons why this person is having the pain, because it's not moving at all.
Yeah.
Then once we identify, for my, like just now, the X-ray is also one of my tool to find out the direction of where I'm supposed to adjust and whether I should adjust the right or the left. So let's say the hip over here, I will be feeling the joints over here. And I'll be feeling, oh, is it moving well?
Okay.
Or is it just really stuck? Even the patient crazy, they because they're familiar already, right, with me, then they will know, oh my god, I feel like this is not moving at all. They would know. Then I'm like, yes, that's the one that I will be adjusting. And with this kind of restriction of the joint, actually sometimes come with some minimal swelling around the area. Yeah. So when you injure your ankle, you sprain your ankle, there's some swelling, right? Same goes to the spine. All these little bones, right? It's not easy at all when we started learning to feel the swelling, to find out the swelling, plus the restriction, plus the tenderness that the patient complained, and then of course the X-ray. It helps. Then we gather all this information, and then we will then adjust. Correct. We will then know what to adjust.
By hand, right? Adjustment is
yes.
Oh wow, that's
by
fascinating.
hand.
That's
Yeah.
fascinating.
Yeah. There are instruments as well.
So how much time does it take? Let's say someone has a lower back pain. How much time, typically, not a serious case, but just a normal back pain, like most of the people complain about, oh my God, I have a back pain, How much time does it take for the adjustment? How many sessions I should ask?
All right. Okay. Not so severe. Within 4 sessions.
Okay.
Can be almost close to 95%.
Well, that's
100.
That's amazing.
Yeah.
So do you also recommend some exercises like yoga? Yoga obviously has a lot of research on helping with alleviating so many other issues like health concerns, but do you also recommend some of the exercises along with your manipulation?
Yes, definitely. Actually, along with my manipulation, right, I will also do some muscle release.
Okay.
Don't be surprised, like what the physio does as well. Totally, I believe in, helping my patient to the max, like whatever that is bothering them. Exercises, yes, I do advise in terms of the activation of the core.
Okay.
Yeah. And also stretching of the muscle, the tight muscles. Yes. And the very basic phase 1 exercises, that's what we call. We identify, I'll show you the photo again. Let's see. I think it's very clear. Okay, maybe these muscles over here as well. We will do like a very simple, like single leg stance kind of thing. Like we will stretch the psoas muscle, that's what we call. Sorry, single hip lunge. And over here, if you see these muscles over here, we call it the QL muscle.
Okay.
I will also prescribe some stretches for that. Okay, because this can you see the muscle? It actually attaches almost the whole entire lower back. to the pelvic.
Yeah, yeah.
Yeah, that's very crucial. Also, I will give the glute. So we call this the glutes stretches as well.
Okay.
Once the stretches done its job, I will also quickly tell them, dude, your glutes are not working, sleeping. You gotta do some clamshells exercises. I don't know if you heard of it.
Can you? I don't know how you can demonstrate the little screen here, but maybe you can tell us what that exercise entails.
Yeah. So maybe I'll show the muscles then. This muscle, it's being done side lying. So this muscle, let's say you're sitting right now. Okay, then you try to fire up your muscles. Just feel your butt. You just fire it up. That's what I'm trying to achieve.
Okay.
If let's say right now there's no problem activating, but there is a problem when it cannot last for more than 5 seconds. Means there's no endurance. Means the muscle is not even doing its job. So with such lifestyle of prolonged sitting, you need that endurance. So then I would encourage, like, look, you can't even reach 10 seconds of glute activation. You need to do 10 seconds. You need to aim for 15 seconds. You need to aim for, then you keep adding the intervals. Then I told my patient, if you can hold it longer, then you will notice actually you become stronger. Yeah. And you can last longer when you're actually sitting for the whole day in front of a screen. Yeah. Yeah.
Okay. Yeah, no, I think this makes sense. So along with the spinal manipulation and the exercise, anything on diet? I know chiropractors also on diet. Is there something that people need to be particular about in decreasing the inflammation of that area with using diet as one of the tools, or no?
For me personally, yes, I do as a chiropractor in my practice. But it's not very super not as professional as a dietitian maybe, but I do know what kind of food that you need to avoid, or maybe what kind of food I encourage them to have more. Like, fish, like like natural supplements like fish oil or maybe salmon, okay, for the omega-3s. Then sugar is a no-no.
Yes.
If you're already highly inflamed and you're like in pain, then I said, please don't eat your ice cream, don't eat your sugar yet. You just reduce as much as you can, because it's not helping you. Or maybe because in Asian culture, we have a lot of noodles, okay, and all the wheat and all. So I said, no, please, it's not going to help with it doesn't help the muscle.
The wheat? You mean the wheat?
Yes, correct. It doesn't help the muscle. So, what I expect mainly sugar is the big one that I totally discourage.
Okay. So sugar is something no, and wheat is a little bit sparingly, right? Which a lot of Asian cultures have tortilla made of wheat, like, that. And then, of course,
gluten.
Gluten.
Yes, gluten.
Sugar and gluten are two things for low back pain. And then, of course, your posture, the way you talked about. And then the third thing is obviously your manipulation, your exercises, so some simple stretching exercises, right?
Yeah.
All right. Well, I think this is very, very useful for a lot of people. If someone has any questions, you are welcome to ask the question right now. Otherwise, you can put it in the comment and we will get back to you. Anything else that you would like to add, Dr. Khoo, for any message that you'd like to tell people?
Oh, okay. I think during, no matter if you have to force to be stay at home or what, I really encourage you to walk, even in your living room, or just even really take that 15 minutes of break, or even half an hour of break. Do your move yoga, do your anything, exercises, just to keep yourself motivated, refreshed, and also keep your muscle going.
Sure. So let me ask you a very interesting question. So there are a lot of research they talk about do not sit for more than 30 minutes, 40 minutes. Is there a golden rule that if I'm sitting still like now, I should not still for X number of minutes and then I need to get up after that?
Sorry, can you rephrase that again?
So
The
what
question.
I'm saying is like how much time, maximum time one should sit in one place and then they need to, is it 30 minutes, 40 minutes? What is that?
Usually it's a range actually, 30 to 40,
Okay,
45 minutes. Yeah.
30 to 45
Mm.
minutes. So if you're sitting for 30 to 45 minutes in one place, you need to get yourself up and start moving. That's the main
Yeah.
thing, right?
Yeah. Yeah.
Yeah, that makes sense. That makes sense. All
Yeah.
right.
I
Well,
mean,
thank you.
yeah.
Yeah. Anything
Mm.
else you'd like to add before we wrap up?
Nah.
Okay. Well, thank
Yeah.
you so much, Dr. Khoo, for really educating all of us. I think all of us have experienced some type of low back pain at some point in our life. And that's what we really trying to bring, simple techniques. You know, you can go to your chiropractor to get the spinal manipulation done. And you can also sit erect and properly and get yourself up and moving, you know, by doing simple things. And nutrition point of view, you're talking about taking up the sugar and taking up the gluten, you know, from your diet. That would help.
Reduce. Yeah.
Yes, reduce that. All right. With that, we'd like to wrap up this session. And thank you again for everyone for your support. Really appreciate that. And make sure you don't get the low back pain, which a lot of the world has. Take it, you know, just get up and get moving. That's the message today. Thank you. Thank you very much.